Garcia, a second-year nursing student from Section WIEDENBACH. So for today's video, I'm going to perform wound care demonstration. Wound care is the septic cleaning of wounds. Step number 1. Review the physician's order for wound care or the nursing care plan related to wound care. Reviewing the order and plan of care validates the correct patient and correct procedure. Step number 2. Gather the necessary supplies. Preparation promotes efficient time management and organized approach to the task. Step number 3. Identify the patient. This ensures that the right patient receives the right intervention. Step number 4. Explain the procedure to the patient. Discussion and explanation help to allay anxiety, encourage patient cooperation, and prepare patient for what to expect. Step number 5. Assess the patient for possible need for non-pharmacologic pain-reducing interventions or analgesic medication before wound care dressing change. Administer appropriate analgesic, consult the physician's orders, and allow enough time for analgesic to achieve its effectiveness. Pain is a subjective experience influenced by past experience. Wound care and dressing changes may cause pain for some patients. Step number 6. Perform hand hygiene. Hand hygiene prevents the spread of microorganisms. Step number 7. Close the room door or curtains. Place the bed at an appropriate and comfortable working height. Closing the door or curtain promotes privacy to the patient. Proper bed positioning helps reduce back strain while you are performing the procedure. Step number 8. Place a waste receptacle or bag at a convenient location for use during the procedure. Having a waste container handy means the soiled dressing may be discarded easily without the spread of microorganisms. Step number 9. Assist the patient in a comfortable position that provides easy access to the wound area. Use the bath blanket to cover any exposed area other than the wound. If necessary, place the waterproof pad under the wound site. Patient positioning and use of a bath blanket provide for comfort and warmth. Waterproof pad protects underlying surfaces. Step number 10. Check the position of drains, tubes, or other adjuncts before removing the dressing. Put on clean, disposable gloves and loosen tape on the old dressings. If necessary, use an adhesive remover to help get the tape off. Checking ensures that a drain is not removed accidentally if one is present. Gloves protect the nurse from contaminated dressings and prevent the spread of microorganisms. Adhesive tape remover helps reduce patient discomfort during removal of dressing. Step number 11. Carefully remove the soiled dressings. If any part of the dressing sticks to the underlying skin, use small amounts of sterile saline to help loosen or remove. Do not reach over the wound. Cautious removal of dressing is more comfortable for the patient and ensures that any drain present is not removed. Sterile saline provides for easier removal of the dressing and prevents tissue damage and minimizes pain. Step number 12. After removing the dressing, note the presence, amount, type, color, and odor of any drainage of the dressings. Place soiled dressings in the appropriate waste receptacle. Remove your gloves and dispose of them in an appropriate waste receptacle. The presence of drainage should be documented. Proper disposal of soil dressings and used gloves prevent spread of microorganisms. Step number 13. Inspect the wound site for size, appearance, and drainage. Assess if any pain is present. Check the sutures, steri strips, staples, and drains or tubes. Note any problems to include in your documentation. Wound healing or the presence of irritation or infection should be documented. Step number 14. Using sterile technique, prepare a sterile work area and open the needed supplies. Supplies are within easy reach and sterility is maintained. Step number 15. Open the sterile cleaning solution. Depending on the amount of cleaning needed, the solution might be poured directly over gauze sponges, over a container for small cleaning jobs, or into a basin for more complex or larger cleaning. Sterility of dressings and solution is maintained. Step number 16. Put on sterile gloves. Use of sterile gloves maintains surgical asepsis and sterile technique and reduces the risk for spreading microorganisms. Step number 17. Clean the wound. If needed, use sterile forceps to clean the area. Clean the wound from top to bottom and from the center to the outside. Following this pattern, use a new gauze for each wipe. Placing the used gauze in the waste receptacle. Do not touch any surface with the gloves or forceps. Cleaning occurs from the least to most contaminated area. Using single gauze for each wipe ensures that the previously cleaned area is not contaminated again. Step number 18. If a drain is in use, clean around the drain using a circular motion. Wipe from the center toward the outside. Use the gauze a single time and then dispose of it. Cleaning occurs from the least to most contaminated area. Step number 19. Once the wound is cleaned, dry the area using a gauze sponge in the same manner. Apply ointment or any other treatments if ordered. Moisture provides a medium for growth of microorganisms. The growth of microorganisms may be retarded and the healing process improved with the use of ordered ointments or other applications. Step number 20. Apply a layer of dry sterile dressing over the wound. Forceps may be used to apply the dressing. Primary dressing serves as a wick for drainage. Use of forceps help ensure that sterile technique is maintained. Step number 21. Place a second layer of gauze over the wound site. It provides for increased absorption of drainage. Step number 22. Apply a Surgipad or ABD dressing over the gauze at the site as the outermost layer of the dressing. This acts as additional protection for the wound against microorganisms in the environment. Step number 23. Remove and discard sterile gloves. Apply tape or tie tapes to secure the dressings. Tape is easier to apply after gloves have been removed. Proper disposal of gloves prevent the spread of microorganisms. Step number 24. After securing the dressing, label dressing with date and time. Remove all remaining equipment. Place the patient in a comfortable position with side rails up and bed in the lowest position. Perform hand hygiene. Recording date and time provides communication and demonstrates adherence to plan of care. Proper patient and bed positioning promotes safety. Hand hygiene prevents the spread of microorganisms. Step number 25. Check all wound dressing every shift. More frequent checks may be needed if the wound is more complex or dressings become saturated. Checking dressings ensures that the assessment of changes in patient condition and timely intervention to prevent complications.